also with behavioral health. I'm the administrator for, some of you might know me from Block Grant, but I help out Amy and James with whatever they might need for opioid and SOR grant too.
And then, let's see, anybody else from BHD on? I don't think so. Charlotte, I see you're on. If you want to do a brief introduction for our SOR grantees here, Charlotte's a new partner that we have with the Behavioral Health Division.
Great, thank you. So yeah, I am Charlotte Williams. I used to be an assistant professor of psychology at Bismarck State College, and now I am a public health analyst with the CDC Foundation. So I am sort of embedded in with the Department of Health, Behavioral Health Services too. My role is to act as a bridge between public health and public safety. So in a previous career life, I used to be engaged with behavioral health. My background is in counseling, and my specialty is behavioral health. I'm currently working on my license to be a psychologist too, so there is a lot of overlap in that, and specifically with substance use, substance abuse. And so my role as a public health analyst then is to really move forward and find like what gaps and how to bridge public health, public safety with the overdose response strategy team. So
thank you. So I'll get started here and share our PowerPoint. Give me a second. Share. And just a few housekeeping items before I get started. I will be recording this and sending it out. Well, it's too large to send, so I have to put it on our website for you guys, and then I'll share the link like I've done in the past. I'll also send out the PowerPoint, and then if we have relevant meeting notes, I'll send those out too. So that's the plan. Today's agenda, we're just gonna do some updates. I have some updates federally and state level. And then I plan to let you guys know how that naloxone distribution assessment turned out after collaborating all of the input that you guys submitted to us through the assessment, and do a little summary. And then I have some resources that I've compiled to share with you guys. And then we'll have time to talk about any successes or questions from you guys. Switch my screens here a little bit. Okay. Update. So first one, the naloxone over the counter. As you guys maybe have heard, the FDA did approve the over the counter version of naloxone. I did send an attachment in the email invite, but I will send that out too, just so you guys can see the press release. So that happened March 29th. As we know, it'll probably take a while before it actually starts hitting the shelves here in North Dakota. The main thing that we really want to focus on is that we're still decreasing those financial barriers for the individuals that are receiving it. So ensuring that people still have adequate access to the naloxone. How that plays out, we don't really know yet. It'll take some time, but we love to hear ideas from you guys if you have any input on that. The next one is...
Oh.
Yeah,
so can I ask,
jump in? Absolutely.
Do you have any idea what the over-the-counter price is going to be on naloxone?
Yeah, great question. I'm sure many of you also had that question. We do not at this time know. Again, if you hear anything, we'd love to know too. And if we hear something, we'll get it out as soon as we can to you guys. The next thing that we have as an update is we just wanted to let you know that the FDA is reviewing a naloxone alternative. Opiate Pharmaceuticals is working on a nasal nalmefene is what they're calling it. Very similar to nasal Narcan. The effectiveness they're saying is a little bit different. So we just wanted to bring attention to that. Here I have a link if you wanted to read a little bit more about it. Again, I'll send this PowerPoint out so that you have the link and can look it up if you want. Mainly with this, we just want to know and hear from you guys if there are concerns with the current Narcan. You know, as we consider an alternative product to purchase and distribute throughout the state, we want to know if that's going to be the best solution, or if Narcan really is effective and is being used to reverse the overdoses. So with that, the main concern is, are you hearing that Narcan is not reversing an overdose from an opioid? We've heard anecdotally that Narcan, you know, obviously isn't effective to the xylazine if that's within the substance an individual is taking, and that it may take several doses of Narcan to reverse an opioid. But to this point, we have not heard that Narcan hasn't been effective at all for an opioid overdose. So again, always wanting to hear from you guys. And if you have any concerns in your areas or input in this, please let us know. Thirdly, we may have talked about this a little bit, but if not, I just wanted to make sure that we included it. The data waiver removal for prescribers that are wanting to prescribe buprenorphine. So that waiver is no longer in place. Prescribers do not have to go through that waiver process before they can prescribe buprenorphine. So with that, there has been some training that's being sent out for providers that are wanting to do this. And there'll be a requirement, I think it's like 8 hours, that prescribers will have to do for education specifically related to this. But it still is decreasing that barrier for prescribers now to prescribe buprenorphine. So again, loving to hear input on anything we can do throughout the state to now increase those prescribers who are actually prescribing buprenorphine products for people. Fourthly, we have some legislative updates. As you probably know, we're deep into legislative session right now. 2 specific bills relevant to the work that you guys are doing with the SOR grant is House Bill 1447, which would create an opioid settlement fund. So there's been lots of talk about the opioid settlement funds that have been received through litigation with distributors, manufacturers, and so on of opioid products, prescription opioid products. So through that, the state has received some funds. Originally, they were going to the Attorney General. This bill now would create a separate fund for these opioid settlement funds to go into. Along that line, with the opioid settlement, there is a requirement that there needs to be an advisory council to guide how the state funds are being used. So Governor Burgum did appoint a council, and they had their first meeting on February 9th. It was determined that all future advisory council meetings now will be put on hold till after legislative session, see how everything plays out, and then we'll go from there after legislative session. The second bill is Senate Bill 2248, which would create a mandatory term for imprisonment for manufacturing or delivering fentanyl. So this really is meant to go up higher in the chain. So trying to reach those individuals who are distributing the illicit fentanyl, illicit opioids, to reach those a little bit higher up on the chain. So not necessarily those who are using the substance, but those ones that are getting it out there to be readily available for people to take. So these are both still being worked on. Feel free to reach out with any questions you have for these, and feel free to look them up and see what's happening with them. Lastly, I just wanted to let you guys know that the Opioid Response Network, or ORN, is doing a naloxone training at UND for all the college students. So we've given them about 1,000 doses or 1,000 boxes of Narcan to distribute there. I don't know if they have a date set yet. I believe sometime here in the next couple weeks that they'll be doing this. So that's exciting to get Narcan out to UND students through the Opioid Response Network.
And Amy, if you don't mind me jumping in quickly, just to add a little bit more information on the legislative updates. So like Amy was saying, there's House Bill 1447 and then Senate Bill 2248. And then in addition to that, an amendment to Senate Bill 2003, which is the Attorney General's budget, was amended to add the language about creating an opioid settlement fund. So we really have 3 separate legislative bills that would create this pot of funding for the opioid settlement fund. which means that anything the advisory committee would want to do with opioid settlement funds would also have to have the legislative approval and tie into our legislators being on board with that. And I did put in the chat, 1447 has the most, I guess, information or specifics that are included in that bill. It does include some specifics on how that breakdown of funding can occur. So there's a 70% set aside for certain activities, a 20% set aside for prevention of opioid use disorder and overdose prevention, and then a 10% set aside for all other allowable uses under the settlement funds. So this is really why that advisory council decided we need to wait until we see how legislative session plays out before we go any further with making decisions on the settlement funds. So again, I think that just provides a little more clarity on why they wanted to just wait until session is wrapped up before continuing to move forward with the settlement funds. And then I do see at least one hand is raised. Karen?
Have you heard anything that some of that settlement funds has been awarded to cities or communities? Because I'm kind of hearing that out here in Dickinson, that our city commission may have gotten some of those funds. Do you know if any of that's been distributed?
So it's our understanding that with the overall state opioid settlement fund, about 15% of that is dedicated to local municipalities. So it could be county or city level, and that some of those funds have been distributed. That's something that you would have to follow up with at the local level. I know that initially in one of the bills, there was a clawback, which that's a term I don't really care for, to try to claw back those funds, and then have that be put into the opioid settlement funds that would be created by these other bills. So it's my understanding that you would have to check with those local levels. And I think we do have some documents on who's all included in those distributions.
And do you know, James, is there any guidelines set out as far as what they are to do with those funds or can do with those funds?
Yeah, and so Amy, what is the name of that appendix with the settlement?
Yeah, Appendix E.
Okay, so yeah, Appendix E does outline the allowable and non-allowable uses of the funds. So it doesn't matter if they're being administered at a state or local level, they still have the same strings that are attached. And I did see somebody holding that up to their camera. Jessica, thank you.
I can attach it and send it out after this meeting with stuff too, and you guys can take a look at it.
Perfect, thank you.
Yes.
I just had my hand up. I can forward you the first distribution amounts that were sent out. So there's been a total of 3 payments that have been sent out to political subdivisions. 2, I believe, from distributors and 1 from Janssen. The Janssen amount was fairly high because it kind of consists of like the first 3 payments all in one, and the next or future payments are going to be much lower. So, but if you send me your email or put your email in the chat, I'll forward you the document so you can get an idea on what's coming.
I see Holly.
And the clawback was removed from the from 1447.
Yeah, I had 2 questions about the update. So, is there a nice summary of kind of the I don't know, the requirements of the settlement? I know you can't do certain things. I'm sure it's like hundreds of pages, but is there a nice summary that we could have, like what's required of the settlement and what's not allowed with the settlement?
Yeah, so that Appendix E, and that, like I said, I'll send that out.
Okay,
That's really
sorry.
that document. I don't know. I don't remember how many pages. It is a few pages, but not like 200 or anything like that. So I think you'll find that maybe a little beneficial. It does kind of break it down into like priority, like this is like the first things that it really should be used for, and then after that it kind of breaks it down a little bit more too. So that
Sorry
you
if
might
you
find
said that.
helpful.
Okay,
No,
sorry if you
oh
said that,
no,
I was
totally.
interrupted. Okay, and then my
No.
next question is about the opioid response network.
Yeah.
So I met with our local recovery community person, and apparently they're working with this network to develop a school curriculum. Do you guys know anything about that?
I had been approached, and maybe it was even from you, Holly, that connect us. I can't remember. No, it wasn't. I'm having a little bit of a blank in my mind of who it was, but I know that they were in your area talking about doing naloxone training. That's the most I have heard. Oh, I'd have to look. I can even connect with you maybe a little bit once I dig back and
Okay,
see
yeah,
who
because it was a
was.
gentleman that was at the
Yeah.
training. So
Okay.
anyway, my question is, it's a curriculum that they did in Denver, and they're customizing it for North Dakota. And so I guess my question is, I kind of asked about evidence-based and all this stuff, and it's a new program, so you don't have any long-term data. So what's the stance on supporting that financially if,
I think
I'm
we'd have to
curious.
look, I think we'd have to hear more about what the curriculum is, and maybe be a little bit more involved in that before giving a final answer. But the SOR grant, broader than that though, the SOR grant can support education in schools. And beyond that, there's not a ton of guidance as to what that may look like or how that may play out. So I think that to give an answer, we'd have to be just a little bit more involved in what that curriculum is and how it's playing out.
Well, that's what I kind of told him. I said, it's silly for all these different entities working on curriculum stuff. It's like, if you want financial backing and support from local public health, it has to be, evidence-based and all that stuff. And so to me, it made sense. Like, why don't we just do it on a statewide scale? But
Yeah.
I don't know how I channel that. Maybe I connect him with you and say, hey, figure this out, or what to do.
I think that
He's
would be a
very
good
passionate
starting
about
point.
it.
Sure.
Pardon?
Yeah, I think we could start there. Maybe
Okay.
connecting with that individual. It may be the same one I've already connected with, but yeah, let's do
I
that.
think
Maybe
so.
let's just connect
Okay.
and
Okay.
then
Alright.
yeah, if it is something that is useful for all grantees to look at implementing in schools, we can absolutely look at something that's broader in North Dakota. And if it is something that's looking really good, that can be an option for others to implement too.
Okay, thanks.
Yeah, absolutely. So we'll connect on that and connect with that individual. Any other questions on any of these updates, both federal and state level? All right, next I'm going to move into the naloxone distribution assessment. So as part of the grant, you guys all submitted this and completed kind of an overview of what's happening in your areas, where naloxone's being distributed to, where it maybe could be distributed to. It was really, really good information to receive. So we really appreciate the work that went into it. I know that it was a lot to do. Many of you said we could have a full-time person just doing naloxone, and I totally get that and I understand that. So we really appreciate the time you put into it, especially those with larger areas. I know that it was challenging to try to fit that into the template we had, so we recognize that and appreciate it. Just as a reminder, we came up with the goal of about 7,810 units of naloxone as a level that would reach saturation for naloxone in North Dakota. And this was based on a Lancet public health model and a whole formulation that was created. So as of yesterday, when I compiled it, we have 13,915 kits distributed in North Dakota since the start of the grant period, October 1. So we are way past the goal, which is awesome. This does not, that number does not include the kits that BHD provided to local public health units. So there's no duplication in this number. That truly is what's being distributed out there. So it really is reaching the people that need it, and that's so great to see. To break that down a little bit more, I hope this isn't too small to see for you guys. But what I did was when looking at the assessments that you guys submitted to us, then I kind of broke it down to see where's naloxone going. So 90% of you are giving it to first responders, 70% to pharmacies, and then anywhere to 30 to 40% home health, primary care provider clinics, schools, treatment programs. 20 to 29% are providing it in correctional settings, libraries, activity centers, community centers, sports complexes, public areas like that. Harm reduction fell in this category, but the caveat is that not each local public health unit is a syringe service program. So we completely expect to see that within that 20% category. And same with some of these other locations or touch points that we have placed in these categories. You know, not each local public health unit has them. So we're not surprised to see that a lower percentage, because not each local public health unit has some of these in their areas. The next category, 10% to 19%, dentists, long-term care facilities, assisted living places, banks, hospitals, human service zones, Suboxone providers, colleges. Again, not each local public health unit has a college in their area. Courts and judges, human service centers, liquor license establishments. That's a very, very broad category. Mental health providers, parks and campsites, fitness, wellness centers. And then the lower category, this is a lot of variety of places, really good places that it's been distributed to. I don't think I'm going to go through all of these, as you guys will have this PowerPoint and can absolutely look, but really it just gives an overview of where it's going, kind of where the majority of it's going, and then maybe give some ideas that you can look at and see, do you have some of these locations in your areas, and is it a place that a high-risk individual might touch? And something that you can look at reaching in your area. So it's really here just information to see what was provided in the assessments, and then using it to see what else you can do in your community if you are able and if it's needed in your community. This slide isn't as helpful, but I still wanted to include it. It's really the percentage of local public health units that identified locations where naloxone is not being distributed to, but you guys were bringing attention to the fact that it should be. So that's what this page, this slide is really just seeing where it's not going, but where it could be going and probably should be going. So this is a lot of overlap on what was on the previous slide. So again, I'm not going to walk through all of these, but a good way to see what you guys really identified as a need in your community is. You'll see that there's overlap, and these numbers won't equal 100% because maybe some pharmacies in your community are receiving naloxone, but you're recognizing that not all of them are, and some still could be receiving naloxone. So that's just an example. These are touch points that you all identified as places that are further distributing it to individuals. So you're providing it to the pharmacy, who then is further giving it to somebody. The little asterisk is just to note that not all of you identified that, and that's okay. Maybe for many reasons you didn't know, which is probably the biggest and most common answer. You don't really know, and that's okay to recognize. Pharmacies are distributing it to people, first responders, through those leave back programs potentially. Clinics are giving it to providers, Suboxone providers, or clinics are giving it to individuals. Suboxone providers, home health is leaving it with individuals, your harm reduction syringe service program. And again, that's lower because not every community is a syringe service program. SUD treatment programs, correctional settings, recovery houses, and mental health providers. The last part of this naloxone assessment information is just additional touch points that could be considered. These are things that either have been mentioned through webinars with other states that I wanted to bring attention to, or even in things that you guys recognize on your assessment that you aren't distributing to, but could be. So currently there is not, or at least not identified on the assessments that naloxone was being distributed to these places, and could be attorneys and lawyers, casinos, which kind of falls under the liquor license establishment. Places that are, or entities that are going out into homes, you know, like FedEx, UPS are going into residential locations and homes, food delivery services, places like malls, medical device and accessory stores, you know, individuals that have had a recent surgery or have maybe had an injury where an opioid prescription was prescribed, maybe visiting these locations due to some accessory need to go along with that injury. Party bus services in the larger regions, salons, and then senior centers, activity centers, and zoos as a kind of outdoor space. Any questions or comments, feedback that anybody wants to share regarding this naloxone assessment before I move on? Okay. Lastly, and I recognize that this might be a little bit small too. This is mainly for you to kind of look at after I send the PowerPoint out to you guys. This is just some resources that I have been receiving the last couple months, and just thought it would be helpful for you guys too. So there's some things in here that maybe could be shared with either current or potential buprenorphine providers. There's some quick start guides from SAMHSA, some practical tools for prescribing and promoting buprenorphine in a primary care setting. So really provider-focused support, as that data waiver has now been removed. There's been some information that I've been receiving about xylazine. So I will always continue to share that and forward that on to you all. Webinars, informational documents, things like that. So here's just a few that I've received. Oh goodness, I'm probably going to get this. The Mountain Plains, the MPATTC. Anyways, long acronym. They had this cool thing, SED Keys to Education. And this I wanted to include for those of you who are maybe fairly new to substance use disorder work, specifically with opioids, even learning about harm reduction, recovery services. This is just, they're short, little kind of educational pieces that for those of you who may be a little bit new to working with this type of thing could find helpful. So it's really aimed towards some grantees. And then lastly, the ATTC did a webinar about harm reduction on college campuses, including naloxone distribution. So that might be helpful for some of you all too. Going to kind of end with just a couple reminders or things I wanted to bring attention to since we were all meeting today. The end of our state fiscal year is July 30th. So this is just a reminder that or June 30th, excuse me, that if you could get us that June reimbursement as soon as you're able to, starting in July, that would be really helpful so we can process really timely here since it's the end of our fiscal year. There's many other months where you guys have communicated, you know, I'm might be a little bit late for this and that, which is absolutely fine. I love the communication that you guys provide. So just drawing attention to that June submitted in July reimbursement is probably a really important time-wise one to the end of the fiscal year. And then there are a few of you that maybe received communication from, I believe his name was Curtis from Department of Transportation, inquiring about doing a Narcan training for their yearly wellness and safety meeting that they put on. Please reach out to me if that's something that you feel like you're not able to do or accomplish, and we can work through that. And maybe I can, you know, pull in other resources and things like that. So I know he had CC'd me on it and reached out to a few of the larger regions or a location in each region. So I just wanted to extend the offer to reach out to me if you have questions or concerns regarding that. That's all that I have to share. I would love to hear if anybody has any questions, things that they wanted to share as successes that you're seeing in your area that would be beneficial for other grantees to hear about, barriers or things that we could talk through, maybe help address, things you're seeing in your area. So I'd love to hear if anybody wants to share anything. I had a little bit of a shorter meeting and carved out some time just to hear from you all. Has anybody implemented anything new? Yeah, Oliver.
Hello. I'd like to share on the one program, and I won't take too much time. In the month of March, we had the highest number of screenings since inception, with over 1,000 screenings conducted in community pharmacies across the state. We have 75 pharmacy locations active and participating. I was reminded of the ORN Narcan training that you had mentioned, Amy, at UND. So the one program did complete an opioid safety and stigma reduction educational program at NDSU just in the last 2 months. There were 9 educational programs conducted, and we have Narcan safety kits distributed throughout campus also. And we have Walsh County and most recently Richland counties are conducting opioid risk screening and naloxone distribution for incarcerated individuals. So hats off to those counties and public health advocates for stepping up and looking at that population of high-risk individuals.
That's awesome. Thank you for sharing that. Is there anything that you guys did differently that has caused that increase in screenings? Is it just more opportunities to do that?
That's a good question. I think we have been working extremely hard since inception, but really the last 9 to 12 months, just an awareness campaign, I think linkage between local pharmacies and local public health units, and hats off to all the local public health units and the SOR grantees for that connection and collaboration between the local pharmacies. I think it's just kind of that repetitive message maybe that just has kind of stuck with the pharmacies. So
that's awesome. Thank you for sharing. Michael, I see you have your hand up.
Yeah, I was just going to mention that our syringe service program is now carrying xylazine test strips in collaboration also with Robin and Fargo. I did an interview recently with the Grand Forks Herald, and they even sent the photographer out to take some pictures. So I'm sure that'll be coming out in the forum communications papers that you see around the state about the xylazine test strips and about xylazine in general. We had an overdose death in March, and one of our syringe service program participants was there, and the way he described it to me was, or she described it to me was, she was injecting with another individual. It was a witnessed overdose in front of her, and she provided 4 doses of naloxone to the individual, and ultimately they ended up passing away anyway, unfortunately. And this person generally is a fairly consistent source, so that's what kind of spiked my suspicion that this could have been xylazine related instead of simply an overdose. So that's why we're kind of scaling up our response, including some outreach to media on this.
Yeah, I appreciate that information. And I know just for everybody's information, the SOR grant is not able to cover the purchasing of xylazine test strips at this time. So props to you for, you know, reaching other funding sources to provide that to your syringe service program individuals. I know I'd love to hear what people are seeing with those test strips, if they are finding a lot of xylazine by using those test strips. So if you ever have any information, Michael, and even and Robin and Fargo and anybody else that ends up purchasing test strips, I'd love to hear how it's going and what people are finding when using them.
Yeah, there's a cross reactivity with the xylazine test strips and lidocaine. And lidocaine is another common adulterant, but that's more of an adulterant in the cocaine supply. So you know, there is that warning with it, but I do think that it'll be more helpful than not in this instance. Our current plan for paying for xylazine test strips will be to use our opioid settlement funds that we've received thus far. So
Sure. Appreciate hearing those updates. Anybody else have anything they want to share? Has there been any more school implementation? I know we had talked about that last meeting and shared some ideas for school prevention and education implementation. Has anybody been doing any more of that? I'd love to hear how that's going, since that's fairly new too, a little bit uncharted territory for some. Yeah, Karen.
We did go into one of the schools, into the elementary schools, and started doing some education on medication safety. And all I can say is I have a newfound respect for teachers.
Yes.
Some of those kids, you know, we did, I think, kindergarten through grade 5. And it's definitely interesting, and, you know, it can be fun, but there's just, these kids get so excited, there's just very little order in those rooms sometimes. But it was definitely a good experience for all.
That's fun to hear. I'm glad you shared.
This is Miranda from Upper Missouri.
Yeah.
Sorry, I'm just on the phone today, but just wanted to share, we have a new kind of strategic partnership. So my, if you're not aware, my boss is retiring from after 30-something years of working with the extension office, and so I have been on the hunt to find a new home to distribute my grants and do all that. And I actually landed at the Western Educational Regional Cooperative. And through this position, I'm going to get to do all of these things and work with all the behavioral health folks in the schools to develop a menu of prevention services for them. And so I'll be able to provide in 11 different school districts the safe medication stuff and any other curriculum weaving or curriculum stuff that we have, and then do naloxone training for all staff in all of those schools and all that kind of stuff. So it should be a pretty unique, exciting upcoming year for us. So
that's exciting to hear it. What an opportunity to reach a lot of individuals, both young and old. So that's cool. I'm glad you shared that. I would love to hear how that goes as you get into it a little bit more. And anything you can share to help others would be very helpful. Thanks for sharing.
Yep.
Anything else? Yeah, Karen.
Sorry, I'm not even sure if this is the right place to ask this question, but I'm working with a conference, and they asked me to look into continuing education units for peer support specialists.
Okay.
Does anybody know where I get that information and how to apply for those continuing education units for peer support specialists? I have left a message but I haven't gotten a call back, and somebody else was going to check into it, but I haven't heard anything, and we're getting closer to the deadline, and I'd like to kind of get that going if I can.
Yeah, so the Behavioral Health Division does oversee the certification of peer support specialists, and Christy Johnson is our administrator for peer support. So I put her email and phone number in the chat, and I'm hoping that that is not who you've already tried to reach out to.
Thanks, I appreciate it.
Perfect. No problem, Karen.
All right. Well, I don't want to keep you all any longer than we need to. So if anybody thinks of anything afterwards, as always, please call me, email me, and we can work through anything that you have. I will let you all go and hope everyone has a good day.